Hello, good people. Welcome to the Save Happy Life channel with me, Dr. Rose M. I am a guidance and counseling consultant, and on this channel, we discuss matters mental health, including the ones that are rarely talked about. And today's topic is adult bed wetting. Adults wet their beds. Did you know that? They do. And there are those days when an adult wakes up in the morning and you're like, did I sweat too much? Or what happened? My bladder went loose? Or your partner, you're sleeping with your partner and next to him or her, you feel the wetness. And then you're like, what has gone wrong? At a personal level, you may remember that dream I had in the middle of the night that I was uh, easing my bladder somewhere. And then it occurs to you that you were actually not in that loo. You were actually in bed and you wet your bed at that particular time. There are many possible causes as to why adults wet their bed. And one of them is hormonal imbalances. Another one is overactive bladder. A third one is urinary tract infections. A fourth one is some medications. A fifth one could be drugs, alcohol. Another one could be stress. Bedwetting is an adult bedwetting is an experience that is never, if ever, talked about because of the stigma it draws. And bedwetting for an adult reduces their level of self-confidence. And the more it occurs, the more they get to feel less and less confident. There are several treatment methods that are available depending on the cause of bedwetting. I want us to focus on stress, bedwetting that is caused by stress. And we say that stress is a stimuli which may cause a physical, mental, or emotional response to a person. The response affects the body differently, and for some, bedwetting could be the effect it has on a person. And this is called secondary bedwetting because as a person wets their bed when they are small, when they are children, but as they grow old, they dry up, and when it recurs again, it's called secondary bedwetting or secondary enuresis. Um, there are several causes of stress-induced bedwetting. This could be feeling insecure in the home, where you sleep in a home or in a house or in a room where you're sharing with somebody and you do not feel safe. So you're already tensed up, you're stressed even as you go to bed. The other one is and being unable to deal with the common everyday stresses that may occur in your life. And when now an adult starts wetting their bed, there are several results that come out of the whole scenario. Number one is further stress. Number two is feeling ashamed. Number three, there is this terrible task of washing smelly beddings every day. And talk of washing the beddings, you may wash the bed sheets. What do you do with the mattress that absorbs most of the urine? Putting it out to dry in the sun is not an interesting thing, especially when it is happening to a parent in a home or in a house where there are children. The other issue that comes with bedwetting is changing beddings at night. You've wet the bed and you have to change the beddings at night so that you're comfortable sleeping for the rest of the night. The other one is reduced confidence level, so much that you fear or a person fears sleeping away from home. It can also lead to number 6, losing a marriage partner. Nobody wants to keep sleeping with somebody who wets their bed, because uh, a wet bed is not the best place one wants to sleep. Of course, it comes with the foul urine or urea smell. It also leads to number 8, loss of sleep. Waking up in the middle of the night to change beddings can interfere with somebody's sleeping patterns. So, what to do? I want us to focus on stress-induced bedwetting, because the other physiological issues can be dealt with by by a medical doctor. And in our treatment levels, I want us to think about ruling out any possible physiological cause of the bedwetting. Talk to your doctor about it, no matter how hard it feels. Number 2, a doctor may prescribe some medicines that control the bladder muscles. Number 3, in treatment, deal with the stress in your life. Number 4, practice positivity and calmness, especially before going to sleep or before falling asleep. Number 5, try stress relieving techniques such as using stress balls, using massage, or just being relaxed and calm as you go to bed. Number 6, talk about it for support. You can see a trained psychotherapist so that you're taken through the stages of managing stress. Number 7, reduce drinking liquids before bed. Of course, reduce alcohol and caffeinated drinks. Number 8, clean and clear the mind before falling asleep, and you will wake up dry. What that means is declutter your mind of all unnecessary things so that when you're sleeping, your mind will be kind of empty or devoid of stressing issues. You will be able to fall asleep easier, and you're most likely going to have control of your bladder muscles. Stress can cause bedwetting, but it does not have to. Talk to a therapist. We are here to help. We are available. Please share this short video with your friends. They may not tell you that they have this problem, but I'm sure a friend of a friend and a friend of a friend might have a problem, and they might just find a solution, or they might find help. Thank you very much for being with me to the end. Subscribe, share, and like the video. God bless you. Bye bye.